It's a bad start to the day for Chris.
I've just seen something on the computer that disturbs me a little bit. My least trusted patient is apparently in the waiting room. She's a terror, an absolute terror. Dangerous, very dangerous.
It's only once a year that owners Tonya and Jamie bring in Bella for just one vaccination jab and one worming tablet. The battle lines are drawn and the chihuahua hasn't lost a showdown yet.
You're not doing a very good job, Holly.
Whoa, she's almost taking my hand off.
Over the years, all I've done to Bella is vaccinated her, wormed her. I did de-sex her, and maybe that's part of it.
Whoa!
Yes, fast. Faster than you that time. In this room, you've got to be on your game. If you're slow, you bleed.
Whoa!
Young Vegemite, love.
In Melbourne, Chris has a more placid patient about to fly up to Sydney for a life-changing operation.
Good girl. Get your bags, Kash. Ready to go?
6-month-old Rottweiler pup Kasha has a serious genetic deformity, which results in the constant and painful leaking of urine.
We had a lot of people say to us, what's the point?
It's only $100 to get them put down.
Just don't put up with it. We can't do that.
Oh, she's my little girl. Yes, I love her. Good girl, aren't you, honey?
Matt and Mel just didn't have the $5,000 needed for the complex operation.
We were pleading to organise some sort of a payment plan. We could give a deposit up front, go in there every week and obviously give them what we had, but no one would accept it. Cried nearly every day, didn't I? It's just not fair on her, it's not fair on us.
In desperation, Matt contacted a radio station. He was put in touch with Chris, who organised Kasha's much-needed operation free of charge.
What would I say to Dr. Chris? I love you. Thank you very much.
Give you right, darling. You won't be in there for too long, mate.
So now the bewildered pup is at Melbourne Airport, about to embark on a life-defining journey.
Bella.
Bella, you look so dainty and so small.
At the Bondi Clinic, Chris is finally giving Bella her vaccination jab.
Good girl.
A victory at last.
And there you go. Jamie.
How easy was that?
Maybe the problem isn't me, it's actually a friend over here. That's it.
But there's still a little matter of the worming tablet.
Got a good start.
Are you going to let him open your mouth? Come on, shh.
You missed it. You're going. Oh, we're in. We're in.
Yeah. Shh.
Come on, Bella. Come on.
Good girl. Good girl.
Oh. That's a good effort for her. She'd be proud of that. She'll go home now and sit on the couch and go, even though it's another year before I get to see him, he's going to feel it, he's going to know about it, and he's going to be waiting for next year.
Thanks, mate.
Good to see you again.
Yeah, good to see you too.
I will. All the best. See you in a year.
We'll rebook.
Yeah. Straight away, thanks. With Tony or Julia.
Out at Sydney Airport, the jet-setting Kasha and her owner Matt arrived to meet Chris.
Hello. We've heard a lot about you. She looks as though she's a bit frisky, so I reckon we go to Bondi, work off some of that energy before she goes into hospital. Welcome to Sydney, huh? Welcome to Sydney.
Later this afternoon, Kasha is booked in to have serious surgery on her rare medical condition. But right now, the puppy's just happy to be lapping up the Bondi experience.
When you came to Sydney, I don't think she had that in mind. Mate, she's got class at least.
Yeah, well, it's got standards, mate.
She's just smacked him now.
Good girl. Okay. You like that, eh?
You're a special girl, aren't you, Case? You're one of a kind.
Playtime is over. Next stop, the Small Animal Specialist Hospital, Sash.
Oh, girl, we'll get you sorted out, won't we? Sarah, can we get 2 10mm syringes of warm saline, please? He's very cold, he's very dehydrated, and he just looks as though he's in a bit of shock as well.
At the Bondi Clinic, a heartbreaking emergency has just arrived. This tiny Joey was found on the side of a road with no mother in sight.
The leg muscle here. That's just going to try and give his system a bit of a kickstart. It's a cortisone-based drug, so it, I guess, improves the circulation, just gets everything revved up, because right now his system's just crashing.
Yeah, that's nice and warm. Okay, great. Mummy's milk.
If we go too fast, then that milk drips down the back of his throat and he's too weak really to close off his larynx, then that milk goes straight into his lungs, and if that happens, then it's going to be fatal. You just can't be impatient with them.
Leah from Sydney Wildlife rushed the baby eastern grey kangaroo into the clinic.
He hasn't been fed properly for 3 days, and normally in the pouch he'd be continuously getting nutrients, having warmth from his mother, so I don't think it's very good.
The family who first found the abandoned Joey fed him cow's milk for 3 days. They thought they were doing the right thing.
Cow's milk is really not suited to them at all. It's got lactose. Now, lactose is a sugar that kangaroos just can't digest. Another 12 hours? No chance. But it's just possible we've got him in time. It's going to be really tough though.
Yeah, she's really quite moist here, isn't she?
Yeah.
Just dribbling even now.
At Sash, Kasha is being examined by specialist surgeon Andrew Marchevsky. Her rare genetic deformity means she can't stop urinating. X-rays reveal one of Kasha's kidney tubes is not connected to her bladder.
So what we'll look at doing is cutting it off at the urethra and then making a little hole into the bladder and suturing it into there and re-implanting it.
So we like just welding it back on?
Pretty much.
Righto.
Fixing the plumbing up.
Yep. Bit nervous. See what happens. Now we'll just see what he says after he does the ultrasounds.
Kasha is given a diuretic, which will make her produce urine quickly.
It's all right. No.
Andrew is hoping the ultrasound will confirm only one tube is faulty. But the news is not good.
Right. Looks like she's got bilateral ectopic ureters. I guess unfortunately what we've found is that both of them are not going to the right spot.
The risk involved in the operation has dramatically increased.
We'll have to be very careful and monitor her kidney function and her urine production. I know it's not quite the news that you want, it's certainly not the news I wanted.
No, it's...
But I guess that's why we did the test, because there was that doubt about it, and now we know, so I can prepare better for tomorrow. But they have got a very close bond. I mean, he's moved heaven and earth to make sure that he can get his dog fixed.
Good girl. You all right?
Fluffy. Yeah, I think it'll be a bit of a mess if we have any problems.
All right. She's all Andrew's now, so seems like he knows what he's on about. Confused me with the jargon, so we'll see what happens.
I'd say what's happening is that the warm blood's actually just pooling in his body.
Yeah.
It's not getting right around.
Absolutely.
So a bit of a massage might actually help. Hey, matey, wake up. Wake up.
A defenceless Joey found abandoned on the side of a road is fighting for survival at the Bondi Clinic.
I mean, it looks silly, but what that's doing is actually compressing the blood that's contained within his organs.
Okay.
And we're trying to circulate that right around. You can get a six-pack as
Doesn't
well.
seem to mind it. Yeah, he will.
But he seems more responsive.
He is much more responsive, isn't he? They're sitting up
Do have
now.
ridiculously long legs though. Have you noticed that? I think you do.
Oh. I'll have to think of a name for him.
He came in a beanie, and I think beanie somehow suits him. And also, beanies are very Australian too, and he is as Australian as they come. Little battler, little Aussie battler.
That got it.
Yes, now that's the ticket. Right on. Oh yeah. Double nods. Yeah, more of the good stuff.
Sugar rush.
There are some good signs, but Beanie is still critical. After a feed, Sarah wraps the little Roo back in his beanie for some much-needed sleep.
I'm impressed the way he's come through the first 6 hours, but really the next 24 hours decides whether he has a future. He's basically had to grow up before his time, and it's up to him and it's up to us to see if he can actually survive that. He's got the fight of his life right now.
Six-month-old Kasha is suffering from major genetic deformities, which means she can't stop leaking urine.
These problems they're huge because, you know, if you can't fix it, she won't be able to be an inside dog. It'll increase the risk of getting infections. Unable to fix it, I think you'd have to be looking, one of the options would be euthanasia for her, so, which would not be nice. That would break his heart, that's right, so.
Yeah, no, I'm pretty sure she'd be right anyway, you know. She better be.
This is difficult surgery, and Kasha will be on the operating table for at least 4 hours.
That's the left one, there's the right one. Yeah, that's interesting.
Is it connecting to the uterus or?
Yeah, wow. You're a general nightmare.
Sadly, the pup's internal problems have been caused by inbreeding.
It's a perfect example of why you shouldn't breed closely related animals to each other.
If the marathon operation works, the puppy will at last have a normal, pain-free life.
I still have concerns for that, but I think we've got a good chance.
Come on, Beanie, let's go on.
Chris is taking Beanie home so the abandoned Joey can get the constant attention he needs.
He's got the seat warmer on. Oh, it's pretty good for Beanie right now.
The sick Roo will need a bottle feed every 3 hours if he has any chance of surviving.
I think we might have got off to a very rocky start. Fresh. Feed and change time, come on. What I'm doing right now is actually just covering him in lanolin. It serves two purposes. One, it moisturises his skin, but also it provides a bit of insulation to him. Well done. Doesn't look the best, but still, well done. He just looks like some sort of alien with his long legs. It's been a real struggle, but I've managed to find the perfect drinking position for him, and he seems to prefer being quite upright. If you do squeeze his hand back, he seems to really enjoy that and actually start drinking quite feverishly. And you can see now he's drained that bottle. The man's got a thirst. You can hear these little squeaking sounds. But thankfully I've got his eyes covered so he can't see the monstrosity that has become his mother. Okay, Beanie. I know from past experience that even though I'm meant to be getting up every 3 or 4 hours, it's not like that. Yeah, up on high for you. You don't get up, feed them, go back to bed, then get up again 3 hours later. You get up, fingers crossed, go and check that they're still alive, feed them, then go back to bed, but then you don't sleep. And it's just that constant nagging doubt and nagging worry the whole way through the night that they're actually not going to make it through the night. He's really guzzling it down, big time.
It's 1 a.m. and Chris has woken up to give Beanie, the orphaned Joey, another feed. But this time, when Chris unwraps his little mate, there's no movement, no sound.
The hard thing is that when he first came in, he looked for all the world like he wasn't going to make it, and we beat that. Last night, for him to be drinking well and sitting up, and so you think in your back of your mind, hey, this one's going to make it. You know, this one will turn it all around, and then you get that shock, and that sucks. It really sucks. Spent the whole rest of the morning just analysing, you know, was he too hot? Was he too cold? Did I give him too much milk, too little milk? Where did I go wrong?
Hey, gorgeous. She's a real sweetie, isn't she? She's a real gentle lady.
Look at this. Fully doily.
It's looking good.
It's a nice stitching, Kasha.
Yeah.
How do you feel? So is she looking like she'll be allowed out in another day or two?
She has to urinate. Until she does that,
She's
I
stuck
really
here.
can't give you a time,
Yep.
you know, and we've just got to go step by step.
Kasha's owner Matt needs to return to Melbourne for work, but the pup can't go until she proves her plumbing is fixed.
You just need to do some wheeze. You'll be all better soon, mate. Hey? Go home in a couple of days. Yes?
No.
At the Bondi Clinic, Chris breaks the sad news about Beanie.
Oh, I'm sorry. You can't beat yourself up about it. You know, again, hindsight's a fine thing. We can only do what we did. We put him on heat, we fed him, we gave him lots of love as well, and that's just as important with these young animals. You can just do the best you can. Look, some you win, some you lose. And we found that a lot with wildlife. If you make it, it's great. If you don't, then, you know, that's when we cry.
At a local beach, Evo is taking his prize Great Dane Rufus and his 6-month-old son Jurgel for their daily swim. But today, something is wrong.
He's had a high fever and he's very weak, very, very weak. And he's off balance. We'll see what the vets have to say. Fingers crossed.
Evo and Rufus arrived to see Chris. The big fear is that Rufus has contracted meningitis, a potentially fatal inflammation of the brain's lining.
Okay, so what we've got is a very, very inflamed and red ear canal. And we push down deeper. You can see as we go deeper, the pain does increase.
Looking at that ear, it's a real mess. It was red, it was inflamed. We've got a lot of black wax in there, and black wax worries me because it's a sign of infection.
There's no doubt Rufus has a debilitating ear infection. But has he come to Chris in time to stop the bacteria spreading?
If they hit the brain, you've got serious problems with diseases like meningitis that can kill him.
Good girl.
Everybody is still waiting for Kasha to prove the operation has been a success. Finally, a breakthrough.
Wayne.
Andrew can now sign her release papers, and Kasha is ready to head home.
Yeah, it's amazing what you get excited about when you're a vet sometimes.
Chris is testing Great Dane Rufus for signs of meningitis, a deadly inflammation of the brain.
One of the tests for meningitis is, and this looks very strange, is to actually do that. And because meningitis is an inflammation of the meninges, which is the layer of cells that wraps the brain up, doing that hurts like hell. And for him to be able to put up with that, despite it being quite a crude test, is telling me that he doesn't have meningitis. This can develop into meningitis though, make no mistake, that can happen. But we're not there yet, and my goal right now is to prevent that from happening. You're probably wondering why these haven't worked? Yep.
Evo attempted to treat Rufus's ear infection with human drugs.
Human antibiotics are a big no-no for two main reasons. First of all, the dog could be allergic to them and have an allergic reaction that could even kill it. So in trying to help it, you could actually do quite the opposite. But secondly, the dose of human antibiotics. How do you know how much is the right amount? Because what a human needs is often very different to what an animal needs. He doesn't flinch, does he?
No, he's amazing.
With the right medication for Rufus, his ear infection will soon be under control.
And can make him much better. It's excellent news. Yep. I'm very, very relieved. Hopefully we should see improvement within the next 48 hours. So that's great.
Chris promised Matt and Mel he'd personally deliver Kasha back home to Melbourne.
Is he? Hello.
Hello, my girl. Hello.
Have they been looking after you?
She's a beautiful dog, just one of a kind in every way possible.
It's brilliant. It's absolutely awesome. And can't thank she say thank you, Dad. But yeah, you, Andrew, and everyone at the Sash Hospital are really good with her. Happy, are you good?
Bottom of our hearts.
No worries
Thanks very much, Chris. I want to give you a hug. Thank you.
My pleasure. She's back.
Hi, I'm Dr Danny Dusek from Bondi Vet. If you love our show and want to see more, plus some amazing content about pets and how to care for them, hit the subscribe button. Click that little notification bell and we'll see you on our next video.